Today we'll be sharing tips and resources for communicating about public health nutrition. And those working in public health, particularly in the nutrition field, face many challenges when trying to communicate accurately and effectively about science and evidence-based information. Yet how we communicate about healthy eating and nutrition matters, as it can influence the policies and programs for where we work, live, and play. And so I'm very excited to introduce our speaker for today, who will pull from his experiences and insights that he's gained in his role, particularly from managing the Harvard Chan School's Nutrition Source website, which is a leading authority on food and nutrition knowledge. So I'm pleased to introduce Brett Otis. He's a communications project manager in the Department of Nutrition at the Harvard T.H. Chan School of Public Health, where he lends strategic support to multiple initiatives, including, as I said, the department's primary public-facing website, the Nutrition Source, the annual Healthy Living Guide as well. He serves as a guest lecturer in the MPH course, Nutrition, Communication, and Practice. And additionally, he's a co-author of Eat Well and Keep Moving, which is a school-based nutrition and physical activity program developed for upper elementary school children. Merging education and training in health communications, journalism, and sustainability, along with professional experience in public health nutrition communications, his work is all about making research accessible and useful to a range of audiences. So welcome, Brett. Thank you so much for being here with us today. So before I turn it, before I turn it over to you, Brett, I'm just going to say a few more things. So we do have several goals for our chat today. We hope by the end of this chat that you've kind of got an understanding of the key elements of messaging, the importance of identifying and knowing your audience for your communications. We hope you'll learn some useful tips and resources to address common challenges in communicating about public health nutrition. And finally, we want to make sure that you have a nice opportunity to network and with peers and learn from others on challenges, current resources, et cetera, to effectively communicate about public health nutrition to various audiences. So finally, I just want to note, if you have any questions or comments, feel free to make those at any time. We welcome any and all engagement from all of you. So I think I will turn it over to our partner sharing session at this time, and really start to kind of get into a conversation here with you, Brett. So we'll start with a question here. I'm wondering if you could give us a bit of a quick primer on the core elements of messaging and the importance of knowing your audience. So in other words, if you were offering a public health communications 101, what would be some of the top pieces of that you'd highlight?
Sure thing. Well, thanks for the warm welcome, Molly. Good morning or good afternoon, everyone, from a stormy Boston area, as you mentioned. And the storm just started up, so if you hear some thunder in the background, it's an extra jolt to this coffee chat. So yeah, just to get into those sort of public health 101, on the next slide, you'll see just some kind of core things to think about when you're designing your communication. So one thing is really just taking the time to think about what you're trying to achieve with that communication. Sometimes this is referred to as the SACO, or the single overriding, in our case, health communication objective. So really, at the end of that interview that you give, what's that one takeaway you want your audience to have? And to that point, who is your audience, and really getting into, what they know, what they need to know first, sort of the context you need to build in. And then, when you're designing your communication, using plain language and cutting jargon where you can, but sometimes there are necessary terms that you might need to take the time to explain and help the audience understand. And similarly, with a public health message, how might you personalize it or humanize the situation to kind of help it hit home? And we can spend a whole time talking about framing, but again, it's really not just what you say, it's how you say it. So, what you say, what you leave unsaid, these choices all matter. They affect how people hear us, what they understand, and how they act. And this Frameworks Institute is a great organization. A link here to some of the resources that they have on framing, I recommend you check out. And on the next slide, so I just wanted to kind of walk through, again, sort of just breaking down the communication process a little bit more. So, and grounding it in an example to kind of take this out of the abstract a bit. So in any communication, you've got your sort of your basis, whatever the content is you're trying to communicate. In this case, we'll use this example of a paper with some co-authors who are here on the call today. They found that this middle school and high school in Massachusetts did not meet federal state minimum drinking water access policies, and so say that, in this scenario, the purpose is that you're asked to share these results and implications in a 10-minute presentation to a school system, which is made up of an audience of various stakeholders throughout the system. And that SACO is really that you want them to understand that water access is limited and that action must be taken to improve that access. So the big question left is, what context does this mixed audience have? What do they need to know to help get them to that decision-making process? And on the next slide, just to, kind of think about this for a minute, you've got a study, say this study, and you've got all these various outcomes, background information, all of those pieces of the study that you might build into that communication. But a big question that we face often is, where do we begin? What do we start with? How do we get this audience engaged? And so on the next slide, this is one framework that you might find useful. I know I have, and a few others have as well. It's a tool called the ladder of abstraction. And there's a link here if you want to kind of learn more about this and more tips on trying it out on your own. But basically, it's just a framework to help organize your thoughts. So with this case in the study, you might map out the contents from the high level, concepts on the top of the ladder, those things that are, broad and sort of abstract, like, this idea of schools being healthy and safe places, moving all the way down to sort of those in the weeds or concrete details, the breakdown of the findings by school, something even as specific as a photo of one fountain or a student testimonial. And the whole idea of kind of arranging your thoughts in this framework is to do what's avoiding dead level speaking. So if you just kind of read across the top of this ladder with those abstract concepts, your message might really fail to understand like the specifics, obviously. And then, on the flip side, if you're kind of lost, stuck in the weeds, people might, not take away the bigger picture. So the whole, you can see these arrows here. You might say, start off to get everybody on the same page that, schools should be healthy and safe places. And, there are these requirements on the federal and state level for meeting water access. But, our school district had many schools that did not align. And, when the fountains were provided, it was the bare minimum. We were just meeting the bare minimum, and that many fountains were dirty, and you can go from there. So really it's when you're speaking and writing, you can move between these levels to help engage and connect. And on the next slide, another kind of interesting piece about this framework is you can think of those rungs on the side of the ladder as sort of that library of extra information, or like the slides in the back of your PowerPoint deck almost, or really just your other areas of research expertise. So someone might ask the question in your presentation, but like, won't these changes be expensive? And you might pull from your other research on the cost effectiveness of water, and so you have this study here where you might say, but well, chilled water dispensers can be a cost-effective strategy. If we invest now, it will increase water intake in the first year, and it will lead to these healthcare savings over 10 years, and go from there into the specifics. So really, again, it's a way to organize your thoughts. This can be useful if you're writing an op-ed potentially, if you're preparing for an interview, a panel discussion, just a way to kind of collect your thoughts in your mind and help get back on track if you're asked a question, getting back to your core messages. So it's a little difficult to maybe capture in the short presentation, but I would recommend you give it a try yourself and see if it works for you the next time you're communicating. So I'll leave it there for now.
Awesome. Thank you, Brett. I love that ladder of abstraction tool. I think it's really helpful, and I appreciate how you've added on that library of extra information piece. I think that's really useful. So I appreciate you sharing that introduction and context. So public health professionals face many challenges when communicating about nutrition and healthy eating. And one of the kind of common challenges that I think we see in this field is to discuss these topics without promoting stigma, especially around weight in particular. And so I'm wondering, from your perspective, what are some ways that we can talk about these topics and either reduce or maybe even avoid using stigmatizing language?
Yeah, it's a really good question. There are a few things here to touch on. So with nutrition especially, I think one factor that's really comes to mind is that food is so personal. So it's wrapped up in our values, emotions, experiences, and traditions at individual level, all the way to cultural level. And so depending on how narrow or broad your audience is, we really need to be mindful of this. not only in the what we're saying, but our visual communications as well. So the images you choose, who's represented, how are they represented, is a really big thing to keep in mind. And another challenge, or it's a fine line, I'd say, not necessarily a challenge, but that nutrition really has this kind of relatable personal hook because of that personal connection with food. And so oftentimes you'll see like news, use like individual foods or nutrients to kind of grab people's attention. And that can be beneficial. It gets people engaged in the content. But I think especially as like public health, when we're providing information to help people with their dietary habits, we also need to acknowledge the factors that influence behavior and health beyond that individual level. So we can talk more about that, but again, to get back to your point about reducing stigmatizing language, a big thing you may have heard, hopefully, is using person-first language so that individuals aren't labeled by their condition as part of their identity. So instead of a diabetic, we'd say the person with type 2 diabetes, or instead of obese people, we can say people with obesity. And there's been some research on this that shows that when people are labeled obese, it can impact how they navigate their condition. It's a complicated, language matters. There's actors and changes needed at multiple levels of the system, with physicians and healthcare providers, and their interactions with individual patients as well. And again, thinking about images, not only what we're saying, but how we're portraying people with obesity, making sure that we're not showing them engaging in stereotypical behaviors that might integrate or inject bias into those images. So like unhealthy behaviors of watching TV or eating junk food, or even worse, which the news media has used for years and years and has fortunately started to taper off, but that B-roll of faceless individuals with overweight that were walking around while a study was talked about on obesity. So a few things there, but yeah, I think those are some of the key things that come to mind.
Thanks so much, Brett. I really appreciate you sharing that, and I want to just kind of highlight in particular about the imagery piece. I think maybe sometimes we don't always realize just how powerful video and images are. We're always thinking about messages and messaging, but your point that that can be such a key element of stigmatization, I think, is really important to think that through. So modeling the good behavior or showing the healthier behavior is always kind of a better option. And thanks also for highlighting person first language as well. I think that's a really great note to make there. I know another key challenge that we see is also around communicating about equity. Are there any particular messages or framing that's helpful to use when talking about health equity that you'd recommend?
Yeah, so I kind of mentioned this a bit or touched on it, but I'm glad to go into more details. That we really need to be mindful when sharing information to help people with their diet and lifestyle habits. As I mentioned, I'm working on the Nutrition Source website. It's a general public health information website reaching a very broad audience, and so we provide information to help people choose healthy foods and live a healthy life. People aren't completely powerless, but we also need to be acknowledging in those communications that those influences of our behavior are far beyond the individual level. From aggressive food marketing, access and cost of nutritious foods, and the interplay of our built environment with ability for physical activity. Those are all things that we need to be calling on policy changes to help minimize or eliminate like individual burden to making those healthy choices. And similarly, just the acknowledgement of structural racism that's contributed to economic disadvantages, healthcare inequities, and especially among the communities of color here in the U.S. So a shout out to Choices Project, because the research that's been done integrating or incorporating that cost effectiveness analysis really does bring or shine the light on health equity when choosing strategies to promote healthy eating and active living to help reduce these obesity and obesity related disparities. So well done, team.
Thanks, Brett. Appreciate that and appreciate your insight. So I think maybe one more question before we kind of shift here. Throughout the pandemic, there has been so much misinformation communicated that has caused a lot of confusion, I think a lot of distrust. And we've seen this same issue, I think, with nutrition for many, many years now. Are there, any quick tips or things that you recommend we do to better communicate or discuss public health information to both counter and limit misinformation?
Yeah, it's a great question. I'll add or if you can share my last slide there. It's a big topic, and to that point, here on the slide, you'll see in the bottom corner, left corner, the WHO, which they've named, this epidemic of misinformation, this infodemic. They've got a really great free course through their Open WHO platform, where you can go in, you can learn about the various stakeholders to help, pre-bunk or debunk misinformation throughout the chain. And it's a great course. I took it earlier this year, so I'd recommend it. Link is there. But yeah, in the short time that we have, just I think some helpful tips to help counter misinformation up in this box in the top left-hand corner. Really sticking to those facts from trusted sources. This is kind of obvious from our point of view. But noting scientific consensus if it's available, highlighting gaps in the logic of the misinformation can be helpful. But also making sure that your content is clear and shareable, especially on social. Utilizing narratives and other creative strategies and making the correction in your message a really memorable part of the message. So not spending too much time picking apart everything that is misinformation in the original message. Being nice, empathetic, and humble. We can certainly use more of that in our online communication spaces, so it never hurts. And then a really important point to keep in mind is that it's really the general public, not that hardcore denier that's your audience when you're correcting misinformation. You're likely not going to change that person's mind who's posting and spreading that misinformation. But if you can, help counteract that, the other audience members may see that, and it may prevent them from resharing or kind of just give them pause, stop that misinformation chain. So just to look at this again in practice, this example over here on the right-hand side, earlier on in the pandemic is something we saw with that like nutrition COVID crossover. This is well before vaccines and well before even the masking guidance was solidified. There was this misinformation spreading that hot chili peppers may prevent and cure COVID. And so, you saw people, pulling in, PubMed articles and all those things that really makes it look to maybe the average consumer really legit. And so one thing that some researchers, looking at this and other misinformation found is that when you're designing a message for correction on social media, there are some important things to do. So there's 4 things laid out here. The first thing is to repeat the correction at least twice within that correction message. So you see here, hot peppers in your food cannot prevent or cure COVID-19. They do not prevent and cure COVID-19. And then another piece is to provide an alternative explanation. So at that time, the best way was social distancing and washing hands thoroughly, and for general health, maintain balanced diet, etc. Another piece is to highlight that credibility, offer a credible link. This might be a trusted logo, although that's something that could be easily doctored. So you really want to be posting from well-established accounts. Providing additional levels of information with a link in that social media post that gets to more information, so it doesn't only exist in the social media space. And then certainly, making sure that your response is timely so that it's not continuing to spread. And a point on this that I think was really interesting when I was reading some of just the recaps and research around misinformation spread during COVID-19, the height of it, is that there were some really successful examples where people caught misinformation before it really spread in English, but in areas where there were a large amount of Spanish speakers, that misinformation was translated and it wasn't caught by the team that were trying to debunk and that misinformation, and it ended up spreading for months among Spanish-speaking audiences through social media. So again, just knowing your audience and being aware of the various places you might need to look. And the WHO in that course shows some really interesting tools that are being used for social listening that could be used to kind of look at this no matter the language. So yeah, just a few resources that I'm happy to share here, and happy to take more questions about that at the end.
Thank you so much, Brett. Thanks for walking us through this helpful example and also kind of tying it all back to the initial knowing your audience piece there, I think is really helpful framing. So thank you for that.